In this session, we will talk about the eyeball dimensions and also about the clinical relevance of axis and angles of the eyeball. Each eyeball is a cystic structure kept distended by the pressure inside it. We call that pressure as intraocular pressure. Although the eyeball is also referred to as globe, we have to understand that the eyeball is not a perfect sphere. In fact, it is an ablate spheroid. And when we say it is an ablate spheroid, it consists of two modified spheres, and these two modified spheres are fused together. Cornea is the anterior part of that anterior smaller sphere, and its radius of curvature is 7.8 millimeters, while the posterior larger sphere is formed by sclera. The radius of curvature of sclera is 12 millimeters. So that's how we consider the eye as an ablate sphere. You have a cornea which forms the anterior smaller sphere, and then you have the sclera which forms the posterior larger sphere. We will understand this better by going through the dimensions of an adult eyeball. And if you see that the anterior posterior diameter of the eyeball is 24 millimeters. The horizontal lateral diameter is 23.5 millimeters. The vertical diameter is 23. The circumference of the eye is 75 millimeters. The volume is 6.5 ml, and the weight of the eyeball is 7 grams. So these are the dimensions of a normal adult eyeball. We'll move on to see the axis and angles of the eyeball. There are three principal axes and three visual angles. The three principal axes are namely optical axis, visual axis, and fixation axis. So if we see this diagram, we will understand that there is an optical axis, and optical axis is a line that passes through the center of cornea, which is P, then the center of lens, which is N, and finally it meets the retina, which is R. So you have an optical axis which is P and R in this case. Practically, it is not possible to determine the accurate position of optic axis because we don't know the exact center of cornea. However, it is easier to estimate the center of pupil, which is considered as the center of cornea for simplicity's sake. So that's the optical axis. We will move on to visual axis. Visual axis is the line joining the fixation point O and the nodal point N, and finally it meets the fovea. So ONF is the visual axis, and finally the fixation axis, which is the line joining the fixation point O and the center of rotation C. So these are three axes of the eye: optical axis, visual axis, and fixation axis. We will then move on to learn the visual angles. There are three visual angles: angle alpha, angle gamma, and angle kappa. Practically, it is the angle kappa which can be really measured and is of some real clinical significance. But yes, there are three angles: angle alpha, gamma, and kappa. Angle alpha is the angle ONA in this case, and angle gamma is the angle OCA. But what is most critical is the angle kappa, and we will see that the angle kappa is OPA. So OPA is formed between the visual axis, which is OF, and the pupillary line, which is AP. The point P on the center of cornea is considered equivalent to center of pupil. And you will see here that a positive angle kappa results in pseudo exotropia, while a negative angle kappa results in pseudo esotropia. So this certainly is of an important clinical significance while we perform binocular vision assessment. Thank you so much.